Welcome back. Now, the Healthy Living Alliance says it's disappointed in Finance Minister Enoch Godongwana's announcement regarding a health promotion levy. It accuses last week's budget speech of going against the constitutional right to food and health care. In response, it says it will embark on an education campaign to reverse the decision. To discuss this further, I am joined by the Alliance's Programs Manager, Nzama Mbalati. Thank you so much for your time, Nzama. We do appreciate it. Just tell us why you are disappointed in the Finance Minister's decision on the health promotion levy.
So we are deeply disappointed. We feel it's a bitter pill because currently South Africa is experiencing a high scourge of non-communicable diseases linked to diet. So if you look at diabetes, hypertension, heart diseases and some cancer, we believe the minister has missed up on the opportunity to actually make sure that he can put people before profit. So we believe that he should have, and if you look across the health taxes, the biggest problem that we're seeing is that even those health taxes on alcohol and tobacco, they're actually below inflation. So one of the biggest problems that we see is that people have been left out in terms of preventing the primary prevention of the non-communicable diseases and diseases that are linked to health. So we believe that the minister could have, in terms of much needed revenue, in the fiscals, to use the fiscal policy to actually support South Africans to make healthier food choices.
So the Finance Minister in his budget speech indicated that the reason why there's going to be no significant increase in the health levy is because the sector has suffered significantly, especially in KZN, because of the floods, and because the sector has not been able to recover because of significant developments. Do you not think that that was a reasonable consideration?
We don't believe it was. There is a reason enough to actually abandon people, and particularly preventing life-threatening health conditions. So if you look at the sugar industry, South African government adopted the Sugar Master Plan to actually support the industry in terms of recovery, right? So we see 3 to 5 years until now. If you look at the sugar industry is not going to survive the scourge of actually, number one, the high labor input, number two, the cheap imports of the sugar industry. So the sugar industry has not been competitive, and we don't believe the health promotion levy is hindering the industry to actually recover. We have been calling for the industry, particularly if you look at the small-scale farmers, which we support as the Healthy Living Alliance, to actually look at actually ensuring that we can have diversification of crops, number one. Number two, the use of sugar, we're not going to sustain the South African economy and the South African sugar industry by actually wanting to actually feed people on the sugar. We have been saying use sugar for other means. There's a booming market in Europe, for example, that is actually looking at ethanol, biofuel, actually, which is booming, and we believe that the industry has a lot to work on in terms of transferring skills, looking at crop diversification, looking at dealing with its own inefficiencies. You know the story of Tonga Bullet in terms of really corruption and mismanagement. So we don't believe that the health promotion levy should have been halted at the expense of pleasing the few, which is the sugar industry.
Okay, so what is your plan going forward? What are you going to do to try and get the attention of the Finance Minister? Because the budget has been tabled and it's probably going to take another year or so for that to be considered. But what are you planning to do?
So we're going to put a lot of advocacy intervention, including, engaging Treasury directly. The official in the National Department of Treasury or the National Department of Finance. We are actually also going to embark on the mass action in terms of the Treasury actually having to listen to people. This is not a child's play. The biggest problem that we think it's actually missing the point is, if you want to support the industry, you can support the industry, but there's no way in which you can stop, promoting health. And we believe that our rights have been neglected. So we'll continue to engage. We're going to the members of parliament next week to actually submit, because Treasury is accountable there in the Joint Standing Committee on Finance, because we believe that it's important that members of parliament can hold Treasury responsible And we believe that Treasury will do the responsible thing by reversing a decision. We don't believe that it's the budget is cut in stone. We believe there is still an opportunity through engagement, through a lot of advocacy effort, and including South Africans demanding that their health are protected, that this decision can be reversed.
And Nzama, would you have wanted the Finance Minister to have engaged with, for example, the likes of you as the Healthy Living Alliance, for them to understand the kind of impact a health promotion levy, no increase in the health promotion levy would have?
Yeah, certainly. And maybe to put it on record, we did meet the members of Treasury before the budget speech, but they were not forthcoming in terms of what is the decision in terms of the increasing of the levy, and what would be the rationale if the levy was not to be increased. They said, no, that's something they cannot disclose. They cannot say whether the levy will be increased or not. Now, what we are sitting with is a ticking time bomb of a higher prevalence of diabetes. You will know that, there are about 10,000 new cases of diabetes, which is mainly the type 2 diabetes, which is linked to diet. So we believe that we have been left out in the cold, and people have been left out in the cold by this decision. So we believe that Treasury should have done enough to engage stakeholders like ourselves to rationalize with us and take us into confidence in really making sure that this decision actually follow proper channels, but also stakeholders who have keen interest in health taxes, including the Healthy Living Alliance, can be consulted and be brought on board.
Okay, great. We'll obviously have to check in with you to see your engagements and, developments around what you're planning to do. Thank you so much for your insights. That was the Healthy Living Alliance Programs Manager, Nzama Mbalati.